Namaste everyone. Welcome to live stream sessions. So in last my session, I discussed about the female infertility, right? So we came to know what is this infertility. Has to regain it once again the knowledge of infertility. What is this infertility? The couple having 1 year of unprotected sex, planning for conceiving, if they had continuously 1 year intimacy, like sexual life, happy sexual life, and the women who are more than 35 years, they will be considered for 6 months. If they had 6 months continuously happy sexual life, then too they are not able to conceive, then this condition will be known as infertility, right? So again, this infertility will be divided into primary and secondary according to the years of marriage. That will be different, but this condition is known as infertility, and we got to know what all causes will be present in women to have this infertility conditions. In last live session we saw it, right? So for this infertility, not only woman is responsible, right? Even mans are responsible. In nowadays, in every 6 couples of infertility case, 1 or 2 will be the case of man infertility. These causes are not only due to woman, maybe the man infertility, like some reasons in man also may cause infertility, right? In couples. So today we'll see what all the causes and preventive methods and treatment if the man is having infertility. It was last session was about females, only female causes and treatment we saw. Today we'll see the men infertility, what all causes will be and how we can prevent, we'll see. So first of all, what is this male infertility? That is, male infertility can be caused by low sperm production or abnormal sperm function or blockage that present in the delivery of a sperm. These all, maybe the production may be less, or maybe this functioning of the sperm may be less, or the delivery, the ejaculation system may be problem. Due to all this, the sperm will not reach the ovum of a girl and the conception will not take place. This is known as male infertility. Whereas in females it was different. According to their reproductive system, according to their age, it was different. And in male, especially the sperms will be the responsible for the fertility or fertile life, right? In males. So this is the male infertility. So we'll see what all causes, points of causes will cause the male infertility. Those are, one thing is sperm disorders, maybe like structural disorder, or maybe ejaculation disorder, or maybe the stimulating disorder, anything. Sperm disorders may cause the male infertility, and structural problems. It may be in sperm structural problem, or it may be the reproductive system. Any male reproductive system organs structural problem may be the cause for the male infertility. And other thing is any dysfunctioning, like other factors like erectile dysfunctioning or premature ejaculation. These all may be the cause for the male infertility. So these are the causes. But some may think that how do I check that if I am a fertile or not? Because though these all, some of these initial points, some males may have, but they may be fertile. They may be the reason for conceiving. So how you can identify whether you are fertile or not? That is, a trained experts, especially who will be experts in fertile or infertility treatment. They will check your sperm count and their shapes, their movement, their motility rate, and their characteristics in sperm analysis. They will do the sperm analysis and they will go through these all points, and they will identify, or they will diagnose that you are able to have a conception, your sperms are fertile or not. They will give a result. And a lot of mans, with low sperm count and abnormality of ejaculation also may have fertile life, as I mentioned last point also, because as we all know, millions of sperms will come out during the ejaculation or during the intimacy, but only we need one sperm to get um, implant through the ovum and have the conception, right? So though you have less count than needed, or the less amount than needed, then too you can have your fertile life happily. Depends on your other factors of health, not only sperm. In less count also, if any other factors are not reaching your fertile life, and in other factors your body is healthy, then in low count also, with the structural problems also, you may be having a fertile life. And next, about discussing a point is causes to reduce this fertile life. Though we came to know, if you are low, if you have low amount also, it's okay. If you are ejaculating less also, it's okay. But what may be the points which cause the fertile, which reduces the male fertile? Maybe your lifestyle, because it's no like compulsory that from birth only, if you have any health issues, then you will have infertility, or if you have any major chronic problems only, then you will be having infertility in males, right? Because our general people will think that if the couples are not getting conceived or conception, then obviously they will blame only females, not a male. They will, if we point out that her male may be having any problem, so they are not able to conceive, they will not agree. No, no, no. Boy is very healthy. He is very active. There is no any chances to get infertile in him. Only females are the reason, they will think. But it's not like that. Though to look the man is healthy, and he is actively participating in every activities, routine activities of life, then too, due to some minor problems in a sperms or reproductive system or reproductive structural systems, then he may have a infertility. So the major cause for these all, like though the man looks healthy and he is active, what may be the causes to affect his fertile life? That is, one thing is lifestyle. As we all know, we have busy, hectic, scheduled lifestyle. That is nothing but indirectly it will cause stress. Maybe the reason for this, and more amount of alcohol intake may be the cause, or the smokers. Not smokers means not a minimal smokers like one or two. The heavy smokers, they may be the cause for the reducing the fertile life, or like obesity, the weight gain. How weight gain? Unhealthy weight gain. If they are healthy weight gain, then no problem. If they have unhealthy weight gain, like due to junk foods or due to sedentary lifestyle, these all, if the obesity is one of the problem or cause for the fertile period, or the use of some particular drugs which affects the motility of sperm, may be the cause, or psychological stress. Nowadays what we are facing, maybe the physical stress or psychological stress, it may be the one of the cause for the fertile life, or emotional depression. Emotional depression also may be one of the cause for the motility of the sperm. And diet and caffeine intake, especially diet is unhealthy lifestyle, unhealthy food which we take regularly, and more amount of caffeine intake, more than our body needed. These also may be the cause for the to reduce the motility of sperm, or to reduce the fertile life of male. And last but not the least, main thing nowadays which is running like a fire is the radiations, that is electric radiations, which affects our sperm count or sperm motility, due to this overuse of systems or overuse of any technologies, like maybe radio radiological rays like X-rays or any MRI rays, anything, or systemic rays, electromagnetic rays. These not on if they use for minimal, like 1 or 2 hours, it will not cause any effects. But continuous use, like if they are working daily for hours together in that race, or if they are working hours together in front of system, then directly or indirectly it will cause the infertility in males, or it will cause it will affect the motility of sperms. So that these all are the points which we are going in a routine life, which will divert the sperms into infertility, or fertile life will be reduced in males. So if we came to know these all are the causes, and obviously the symptom will be if we symptom will not be accurate, because some may have sexual life correctly, but they will not be able to conceive, or some may get problems in sexual life like premature ejaculation, or problem in the erection. These all may be some may have these complaints with the diagnosis of infertility. So it depends on the prakriti of a person, how the bodies or how his nature is, and how he will react to the complaints. So coming for the preventive steps, because every disease or every condition have results, right, or preventive steps. By preventing these, by following these steps, we can prevent the further diseases. So what all preventive steps we have? One thing, obviously we should maintain a healthy weight, as I mentioned, because this obesity also is one of the cause for the infertility. So maintain your healthy weight and have healthy lifestyle, maybe diet or activities in your life. Have a healthy lifestyle. Don't follow junk foods. Don't follow stressful, physically stressful life. Maintain your health and activities of your life in a healthy way, and prevent sexually transmitted diseases or infections, because infection is also repeated cause of infections may also affect the motility rate or the functioning rate of the sperms. And manage emotional stress. This emotional stress also may be the one of the cause for your functioning of the sperm. And you can have regularly, like pineapple juices. I have collected some study. Use of pineapple juice in a regular basis will increase the sperm count and the functioning of the sperm. According to study, I have collected some study that according to study, 250 men were given trial who have sperm analyzed at a fertility clinic. Showed a man who ate higher amount of fruits and vegetables, particularly green leafy and beans, had higher sperm concentration and better sperm motility compared to men who ate less these type of foods. That is, if the men's have more amount of fruits or more amount of vegetables, their sperm count may be, the functioning of sperms may be, the result will be good. Whereas when we compare same men who will not eat these all in a more quantity on regular basis, if they didn't have fruits, vegetables, they will be having lesser amount of sperms, and the functioning of sperm will be less. So eat at least 5 portions of varieties of fruits and vegetables every day. You can include the vegetables and fruits, one type of vegetables and fruits in your daily routine, in your foods or snacks or breakfasts. And each time, because to increase the amount, As we know, only one sperm we need. The man will ejaculate millions of sperms in ejaculation, but we don't want the amount. We want only single sperm that whose function is very nice, so that through the way the sperm can reach out the ovum and it can have the ejaculation, conception, right? So as much as possible, um, keep your sperms active. The functioning should be good. That's it. The amount or anything won't matters here. So especially as I mentioned, in fruits and vegetables, especially pineapple juice increases the sperm count and functioning of the sperm. So you can add in your regular basis, one day pineapple or one day pineapple juice or any other pineapple forms you can add in your daily routine. And the some exercises what you want to follow to prevent this infertility rate or to increase your fertile rate. That is, weightlifting you can do, or running and jogging, very associated with the high sperm concentration. These are especially running, jogging, or weightlifting will increase the concentration of sperm. And other type of exercises like walking and all you can add in your daily routine, so that your body will be also healthy and you can have a fertile rate. And coming for Ayurveda, what type of treatment you can have in Ayurveda for this fertile period or fertile rate of life? Especially if you have any complaints, then they will go for some particular oral medications according to your complaints, and they will advise further lifestyle. But if you won't have any complaints, particular physical complaints, then directly you can go for ashwagandha granules, so that whatever sperms count you have or whatever the dysfunctioning of sperms you have, it will be stimulated. So regularly you can have ashwagandha granules with milk. And coming for panchakarma procedure to detoxify your body, our Ayurvedic physicians will advise matravasti or niruhavasti according to your body prakriti. So you can go for vasti treatment, which will be followed as abhyanga, svedana, and vasti, which will detoxify your body, so that whatever oral medications you are taking will give 100% result to your body. Because without detoxifying also we can give. You may be thinking, what ma'am will say, in every disease we should go for panchakarma, right? So because what this panchakarma will do, panchakarma procedures will detoxify your body, so that whatever oral medications you are taking will give you 100% result. So this was the small topic about male infertility. If you have any other points to discuss, you can comment in a comment section box. I will go through and answer you. Thank you.